Today I will be showing techniques to increase range of motion and strength for the ankle plantar flexors, gastrocnemius, and soleus. Passive range of motion is performed as an early intervention to minimize contractures while increasing proprioception and circulation when patient cannot move the muscle actively. To perform passive range of motion of ankle plantar flexion, the patient is positioned in supine with the feet hanging off the side of the plinth. PT positions self in front of the patient, cupping the heel for stabilization as motion is applied between plantar flexion and dorsiflexion on the dorsum of the foot below the talocrural joint. Joint mobilizations are performed to reduce pain and increase range of motion at selected joint movements along the joint sliding motion. For talocrural plantar flexion, the convex talus moves on the concave tibia fibula, causing a posterior roll and anterior slide. Thus, a joint mobilization will be performed anteriorly. To increase range of motion at this joint for plantar flexion, the patient is positioned in prone with feet hanging off the side of the plinth. The therapist stabilizes the dorsum of the foot and the talus and performs a grade 3 or 4 anterior glide mobilizing at the calcaneus. A grade 3 non-thrust oscillated mobilization is performed up until the feeling of joint resistance. A grade 4 is performed at a small amplitude past this resistance point. Each oscillation is performed rapidly 20 to 30 times for several sets. Not only can these mobilizations improve range of motion, but have been shown to increase balance in the elderly. Stretching of the plantar flexor muscle gastrocnemius is performed by placing the patient in supine with feet hanging off the plinth. With the patient's knee extended, stabilize the shin and cup the heel, placing the patient into dorsiflexion using your forearm to apply pressure into a stretch. This static manual stretch is performed at a low load with a duration of 15 to 60 seconds for several sets. Strengthening of the plantar flexor muscles can be performed by asking the patient to do single leg calf raises. The patient positions self in a standing single leg stance, using a table for balance if needed. The patient is instructed to lift up onto their toes all the way up and back down with the foot flat on the floor. This bodyweight resistance exercise can be performed for 8 to 12 repetitions for 2 to 3 sets on both legs.